It's the Eagle Community Television Forum with your host, Gary Shorman.
Hi, everyone, and welcome to the Forum here on Eagle Community Television. I'm Gary Shorman, and the program is brought to you by HaysMed. Our guests today are from HaysMed. We'll have two of them. First off is Kevin Myers. He is the head of the critical care unit at HaysMed. And we'll also have Lindsay Rut, who's head of the new unit we're going to be talking about the Convenience Care Center. First off, Kevin, welcome to our program.
Thank you.
You've been a part for the last few years at HaysMed doing things in the emergency and critical care side of things. Tell us a little bit about your background.
Oh, my background? Well, I grew up here, went to school here, graduated from Fort Hays with a nursing degree, and from there I was able to get into the emergency department at the hospital. Worked there for a few years, and then we brought in the Eagle Med flight service, so I was able to share my time between the emergency department and the flight services and help grow into Western Kansas those fixed wings and helicopters that we see today. And then I had the opportunity to move to Kansas City and expand on emergency medicine, and worked as a manager at downtown St. Luke's for their ER, their level 1 trauma center, and then came back to help be with the parents and bring all my kids home and see grandma and grandpa. And I've been here about 4 years now.
Well, it's great to see that. It's great to see somebody that's from here, back here, really taking care of people in Northwest Kansas. So Kevin, it's good to have you here. You have been part of the emergency care, the emergency room area for now the 4 years. That part of things has really changed with emergency care, because I know it's been very busy over there, and adding the convenience care part has helped that. What was the process of really developing the convenience care from the typical emergency room?
Sure. The needs out there today are people are looking for access to care, and they want a cheaper alternative than the emergency department. And when you look at a community our size, there's, once the physician offices close for the day, 5 o'clock, what do you do for that child that has an ear infection? It's Saturday or after 5.
Child screaming, needs something, yes?
All night long usually, and you're wanting somewhere to go in the morning. And where do you go? There's not a lot of alternatives out here. So you're stuck with the emergency department. The emergency department is a great place to go. We have all the resources and care we need there, but it is a high dollar bill. It's just the healthcare world. So the goal was how do we get somewhere that brings that efficiency and opportunity kind of at a better hours, where the ER is 24/7, but how can we help meet the needs of the community to give them alternative care that's not so expensive? Our first phase, we knew we were going to want to do some kind of clinic option, but we didn't know what that meant yet. What you see in other areas and communities, that they're either opening freestanding emergency departments or they're opening up freestanding urgent care centers, which is closer to an emergency department, but it's not a clinic.
So what is the difference between those different levels?
You have a freestanding emergency department, which is full functional ER. So if you take our ER and just took the department itself and moved it somewhere else, it would function that way. You see that more in the cities, and they're trying to offload the capacity that they're seeing in their current ER attached to the hospital, and they're taking their ER and putting out into a community where maybe you don't have to go to that large ER and be stuck in a 6-7 hour wait, versus you can go to your local ER community area and be treated the same 24/7. An urgent care center does not have a place to admit, for example. So if you come in with chest pain, they can work you up for so long, but you will get transferred to that emergency department. But they'll have more services. They'll have physician there, they'll have radiology there, they will have lab on site, those kind of things. So it's close to an emergency department, but doesn't have the full service, but can do quite a bit. What we are doing is taking that pendulum and swinging it the other way, closer to a clinic level where we see lower acuity items. But the goal is to give you that lower cost of a clinic visit. So the clinic, what we wanted to do first was we were trying to figure out how do we address that cost with no clinic right now. So in the emergency department, we opened what we called the fast track last year. It was open for about a year, and we were able to bring in mid-level providers like nurse practitioners and physician assistants, and we brought them in the emergency department, looked at our peak of the day for the ER, which is 2 to 10, and we have our highest volume, and we plopped in that mid-level provider to see those low acuity items that, as we're having emergencies go on, you have that person with the ear infection come in and they're waiting. They're simple to see, but we can't get them in because our beds are full with more acute patients that need admitted to the hospital. So what that allowed us to do was have a mid-level to take that person out of that waiting room quicker and put him there. and we averaged about 90 minutes. We were at the time able to give a 25% discount to the ER bill, which was nice, but still 25% off a large ER bill, still quite not enough for that ear infection, and we knew that. But we were having success on the kind of the convenience and the time, but we weren't addressing the cost, if that makes sense to you. So the next step was, can we just open a clinic off-site where you have that low acuity item and go to somewhere off-site as a type clinic visit, get a clinic type copay, and be much more affordable.
When you look at the affordability costs, when you have an emergency room, you really have to equip the emergency room to deal with everything.
Yes, absolutely.
Even the real serious things that are out there. And so you have to have, everything has to be set up, the rooms have to be set up. When you look at just a critical care clinic, it is set up, like you mentioned, ear infections, but what else do you consider in that? And what is the crossover point before somebody should say, we need to take Dad to the emergency room versus a critical care clinic?
If some ways you can look at it as if it looks like an admission. If I'm going to get admitted for my chest pain, that would be something to take in. But I think how our mid-levels have said is walk-in clinic really means walk-in clinic. If you think you can walk in and you're healthy enough to walk in, or your injury is slight enough where you can walk in, that is an easy way to see it. And what we find, the general public pretty much separates what's an emergency versus not. If it's life-threatening, potential for life-threatening, they use the clinic as an option. So we're limited on to what we can address. We don't have full lab work. We don't have full radiology capabilities. We're just limited to like plain films and just basic lab work, just to know which direction you're going. And if you're too sick, we'll send you to the emergency department.
And that's also the reason and the way to keep costs down.
Yes.
For some parent that wants to just make sure there's not something critically wrong with their kid or their child or their family member.
Exactly.
To be able to, have you been surprised so far? And then we're going to bring on Lindsay, and Lindsay's going to talk about what happens right at that site, because she's there every day. But are you surprised with how well this has gone over?
Yes and no. We knew it was a need, and we've seen the need for quite some time. It was just, how do we get there? What we're surprised about is how successful it is, because the numbers are, you have numbers on paper, and your numbers are usually conservative, and our numbers have done much better than expected. So it even tells us how much a need there really was out there. People were waiting for such an option. As I've said, the injuries and illness happen past 8 to 5 hours and on the weekends, and we have to be able to address that time of day. I have 4 kids of my own, 4 little ones, and it's always Friday night when they get sick, and where you go Saturday morning.
How do they schedule that anyway?
It's amazing. It is amazing how they do that. It's like clockwork. Or you're leaving town and they're getting sick, and how do you get addressed? And so that's where we're seeing the wins, where people are taking advantage of those situations.
You mentioned 90 minutes. One of the things, emergency room, because there is that vast group of people from the very not so serious injuries that people want to be seen for, all those a serious one, and it tends to just back up. Right. And a typical emergency room takes a lot longer than what most people want to set there. You mentioned 90 minutes inside of the critical care or inside of the convenience care unit. Is that holding pretty close to true?
Yeah, with the fast track, we're averaging 90 minutes or below, and right now it's walk-in. So if you time it right, it could be as quick as 15 minutes. If you come in during a rush where maybe 8 people showed up at the same time, if you figure about 15 minutes a person, time you check in. If it's a low acuity item where you just need a prescription for something, it could be a quick visit. But if you have 8 people in front of you, figure 15 minutes a person, it could be a good hour and a half type feel. So what we're doing, we're making changes now as we alluded to before, is we're quite surprised how busy we are. So we're looking at how do we change our staffing model? What do we need to do for hours to offset that? So because we want to stay very convenient and timely. So we want to definitely lower those times.
We're going to talk to Lindsay here in a little bit, but how have you found your staff, and what's the team like over there? And then we'll have Lindsay talk about the other thing.
We opened it up on our hospital website, but internally through the hospital, we had a lot of applicants, people, and working with, we have tons of employees in that hospital, and it was easy to see who would match. We were able to interview many candidates for all the positions. We have front office staff, we have nursing staff, and we have the mid-level providers. So we took a good solid probably month to 6 weeks to do all those interviews and find those people, and it wasn't hard. We had really too many good people to choose from.
Sounds like you have a great team over there. We're going to talk to one of those team members here in just a second.
Yep.
Kevin, thanks for being on our program today. Kevin Myers, who is the head of critical care at HaysMed. Back with more after this.
HaysMed is your first and best choice for healthcare. They're the only facility providing tertiary level services in this region. With more than 70 physicians and 26 specialties ranging from heart, orthopedic, spine care, cancer, obstetrics and gynecology, wound care, rehabilitation and surgery, including the Da Vinci robotic surgery, HaysMed is your comprehensive health provider for people throughout Western Kansas. HaysMed, helping people be healthy.
It's a beautiful day in our super high-speed internet great customer service neighborhood. Like you, this is where we live. In fact, our company is employee-owned, so it's our goal to improve the quality of life for everyone in our community by delivering faster, more reliable internet, clearer, more feature-laden phone service, quality TV channels, all with the level of customer service you'd expect from people who are your neighbors. Eagle Communications. Our community connected.
Welcome back to the second half of our forum here on Eagle Community Television. If you have any ideas, comments, suggestions about future programs, let me know. Gary.Shorman@eaglecom.net is my email. You can also go on to Facebook, and you can find us under ECTV Forum. We'd like to be your friend. Check us out, and you can give us suggestions there as well. We've been talking about the new Convenience Care Center here in Hays, and we have one of the physician assistants with us right now, and her name is Lindsay Rut. And then, Lindsay, tell me what you do every day. When you're over there working. You work, seems like, all the time over there, is that right?
Yeah, we're working 12-hour shifts, so we're keeping very busy. I really feel like we're helping the community out. We're seeing a lot of patients, that aren't sick enough that they need to go through the emergency room, or patients also that aren't able to get in to see their primary care that same day. We're able to help those patients out. Seeing a lot of upper respiratory problems, minor lacerations, some orthopedic injuries, fractures, dislocations, things like that.
Well, as a physician's assistant, I was pleased because you brought along your stethoscope in case something happened to me today, so you're ready to go for that. When you started doing this, are you surprised at the patients that are coming in, the number of them?
I think that was the biggest surprise. Is I knew that we were going to be busy, but I just didn't know just how busy. And most days when we open up the doors at 8 o'clock, we may have 8 or 10 patients waiting for us already. So I can see that there's definitely need of the community, and we've been able to help meet that need.
You mentioned 8 o'clock because we want to talk a little bit about times of the Convenience Care Center, because that's one of the goals is, that while the emergency room is open at the hospital, open 24 hours a day for emergencies, parents may want to say, hey, it's much more cost effective to come to the Convenience Care Center. You start at 8 o'clock, Monday through Friday. What are your hours and what are the weekend hours?
Monday through Friday, we're open from 8 until 7:30 at night. And then on Saturday, we open at 9 and close the doors at 4:30. And on Sunday, we're open from noon to 5.
So even on a Sunday, somebody has an accident or something like that, they don't think it's enough to go to the emergency room. You have a chance. What about that parent on a Sunday morning or on a Saturday night late after you've closed already? Well, what do you tell the parents to do?
Well, I really think, you have to look at how severe of an illness or injury really is. If it's something that could potentially be life-threatening and the clinic's not open there, we're not equipped to deal with life-threatening injuries or illnesses anyhow, then they definitely need to go through the emergency room. But if it's a concern that maybe they have an ear infection or, it's something that's more minor that you feel could wait a couple hours, then yeah, get there as soon as we open, and we'll be willing to help those patients out.
And I'm guessing if a parent has a question, they shouldn't mess around with it. Just go right to the emergency room if there's a question about how critical it is.
That's exactly right.
What will a patient see when they walk in? Because you're at a new location. It's at the Oak Park Medical Complex, which is just to the south of the hospital. What do they see when they drive in there?
Well, I do know this. It's a little bit difficult to find exactly where we're at. I know that new signage is going up as we speak. But once you get in there, we've got a very welcoming waiting room and staff. After getting checked in, we see patients as they arrive. So in an order basis, The nurse will bring you back. We do a full set of vitals just like you'd have done at your primary care physician's office, and then you wait to see the mid-level provider. So it's staffed by physician assistants and nurse practitioners, and we have all the capabilities to do a full examination. We have testing that we can do. We call point of care testing, running anything from flu tests, rapid streps, mono, you name it. There's a lot of things we can do on site there. We also are able to draw lab and have that done the same day and send people out to get x-rays that we can then interpret and get interpretations back on. We can splint patients, we can repair lacerations. There's a lot that we can do there. So, and then we're fully equipped with electronics to where we can prescribe medications and have them waiting at the pharmacy by the time the patients leave our clinic.
So I mentioned that, kind of south of the hospital. It's actually, if you go farther south than just across the street from the hospital, it's down by the high school. You'd actually drive by the high school, and so you're in that area of Hays. If you're traveling and saying, boy, I would need to get there quick, you go down on 13th Street and go past the high school, and it's on the north side of the road there. But it is kind of just an entirely different thought process. If someone has a family physician, is it still smart to go to the convenience care clinic?
I think it's still a good idea to call your family practice provider just to know, so that they know that you're ill, and if they're able to see you. I know that the doctors like to see their own patients, but a lot of times they're not able, they're booked full, and that's when they've been directing patients over to see us. And we've been really mindful of trying to communicate back with their family practice providers so that they can see those patients and follow up, and they know exactly what kind of care we've provided for their patients.
So there's communication then back and forth to that, so you can then have the follow-up that way.
Exactly.
If you were to do it, and you're a parent out there or a family member doing this, and my guess is anywhere in the whole area of Northwest Kansas, it becomes a real, not say blessing, a real opportunity to have something like this available. I'm guessing that you've seen a lot of flu recently. Is that correct?
Yeah, we've been overwhelmed by the flu that we've seen. Hopefully maybe that's starting to slow down, but we've definitely seen influenza A and B both in the community.
Well, Lindsay, thanks for being on our program. The hours again.
All right, we're open on Monday through Friday from 8 o'clock in the morning till 7:30 p.m. On Saturday from 12 to 4:30, 9 to 4:30, and then on Sunday from 12 to 5.
Okay, that's a good test because I wasn't remembering all that, but it's open when you need it 7 days a week. It's the new convenience care clinic as part of HaysMed. It's in the Oak Park Medical Complex, which is just across the street and a little bit to the east from the high school here in Hays, Kansas. Again, thanks for watching our program. Thanks to Kevin for being on the program. He's head of critical care, Kevin Meyer, and Lindsay Rut, who is a physician's assistant over at the critical care or at the convenience care center. Thanks for watching the forum. It's brought to you by HaysMed and by Eagle Communication, our community connected.
HaysMed is your first and best choice for healthcare. They're the only facility providing tertiary level services in this region. With more than 70 physicians and 26 specialties ranging from heart, orthopedic, spine care, cancer, obstetrics and gynecology, wound care, rehabilitation and surgery, including the Da Vinci robotic surgery, HaysMed is your comprehensive health provider for people throughout Western Kansas. HaysMed, helping people be healthy.